Thank you everyone. My special thanks goes to Dato' Alia and Dr. Ng Woan Tyng for gracing our event today. Let me start my presentation by telling you, know your dentist. What? Now, firstly, one has to be legally qualified to be registered to the Malaysian Dental Council upon successful completion of a recognized dental education and training program, whether national in our country or abroad. Now, what is Malaysian Dental Council? We call it MDC. It's a statutory body established under the Dental Act 1971. We call it Act 51. And it aims to ensure the highest professional standard in the practice of dentistry in the interest of the patients, the public, and the profession through the administration of the Dental Act. Now, I just share some information on the MDC certificate. Okay, so this is briefly what you can find, when you enter a clinic. That is me, 30 years ago. Okay. So you probably can see the pengakuan pendaftaran. So that is a number where you can check the receipt and the photo. Well, that is 30 years ago, so much changes. And the address, the house address, right? Now, although it's registered, it does not really mean that a dentist can practice legally. So a practitioner must possess a valid and active inner practicing certificate for the current year, that year. Okay. Now the APC must be displayed in the public area of the clinic. Now besides, one can actually check whether the practitioner is actually holding a legal and a valid inner practicing certificate. You can check, and one may also log on to the Dental Practitioner Information Management System (DPIM). Just log on and double check the status of the registered dentist, whether he possesses a valid inner practicing certificate. Now thirdly and lastly, the premise of the dentist works. The place that you visit the dentist must be registered under the Private Healthcare Facilities and Services Act. We call it Act 586. The registered certificate must be displayed in the public area too. So this is precisely. And you can see there is a number series 00022 and the bottom G with a seal. Okay. Besides that, this is dentist basically. Now, upon obtaining after obtaining a basic degree in dentistry, one can choose to enhance his skill and expertise in a specific field in dentistry. Now, the dentist specialty recognized in the Ministry of Health Malaysia currently we have two categories, hospital-based and non-hospital-based. So we have oral surgery, pediatric dentistry, oral pathology, oral medicine, forensic dentistry, and special need dentistry. So the non-hospital-based are orthodontics, periodontics, restorative, and dental public health. Now, what is oral surgery? Oral surgery is a branch of dentistry which deals with the treatment of facial injuries, reconstruction of the oral and maxillofacial region, and dental implant surgery. Care for patients with tumor and cysts of the jaws, as well as correct function and aesthetic conditions of the maxillofacial area. The oral surgeon is based in the hospital and works as part of a team with other specialties in the hospital for the management of the patient. So this is one photo that I can share with you. Coming is the pediatric dentistry. So pediatric dentist deals particularly with the oral health care of children from infancy through the teenage years, including medically compromised children